Hi, everybody. I am Tiffany with Rock Bottom Wellness. I'm a board certified and licensed nutritionist, and I'm so happy to be here to talk with the Pink Ribbons event. I do think it is so important to move away from awareness. We are all aware of the issues and the people that have been touched in our lives with breast cancer. And it's so important to learn about ways to empower yourself and to take back your health and to do things you can do and be proactive and supportive of your health. So that's what I'm here to share about the connection between thyroid cancer and breast cancer. And I'm going to tell you a little bit about my story, and then I'm going to go through some information about the link between breast and thyroid cancer. And then I'm going to give you some tips that you can take away to start incorporating into your life right now to help you improve outcomes and to help you feel amazing and get healthier. So we'll just start there. So my story is a story of being diagnosed with thyroid cancer in 2007. I am suspicious, and I will say my gut tells me that I probably dealt with that for much longer before I was diagnosed. I'm guessing 10 years. And I even suggested that the type of thyroid cancer I had, even though it had spread to my lymph nodes, it had been there for quite a while. Now, they also will tell you that with thyroid cancer, there's really no symptoms. I beg to differ. I had classic thyroid symptoms, but my TSH testing that was done, which that was the only thing that was done until the diagnosis, always said I was in the normal range. But we understand now, and as a functional practitioner who helps thyroid patients get over their issues and overcome their issues of the ancillary symptoms that are probably more bothersome than the actual thyroid condition, we are learning that the symptoms are varied and many and can be so devastating and debilitating for people. So for me, I was told that thyroid cancer is the easy cancer. This is no big deal. So my expectation was that I would have my surgery and my treatment and all would be fine. And I would probably feel better than I have in the last 15 years prior to this diagnosis, because I can go back to high school and I can look at my symptoms, which I had, I was very active and had a lot of friends and did a lot of activities. I'm from a very small town in North Dakota. So it was just a lot of go with, I wouldn't seem like it when you're from a little tiny town in a rural state like that. But there was lots to do because, if you were doing stuff for your school, you kind of did all the things for your school. So I was able to do that. I got my schoolwork done. I had jobs. But there was a lot of underlying depression. There was a lot of underlying fatigue. My sleep habits were horrible, probably more horrible than a normal teenager, as far as getting up and feeling, not rested at all. When the thought should be, oh, you're young and you're healthy. You should have all this, energy and great outlook and all that kind of stuff. And I just didn't have that. And it was very depressing and really hard. And it only got worse, of course, in college. And, there was a lot of outside stress in my life that was not in my control whatsoever. And so I believe that played a part as well. And then eventually that summer, I should say the fall, but the summer before I got diagnosed, I had horrible symptoms of terrible fatigue. I gained 20 pounds in probably 6 weeks and hadn't done anything different. Very active, going to the gym, doing all kinds of classes, actually over exercising, which is another factor I'll talk about later. I had many things that were affecting me. I felt sick to my stomach a lot, nauseous. I had a lump in my throat. But again, they will tell you there's not really a lot of symptoms tied to thyroid. But when they're also not checking all the parameters for thyroid, then, sometimes there might be missing things. So it was identified at a routine physical. I went in for my yearly exam. Part of that exam and that appointment was to get anti-anxiety medication to start the school year because I was a teacher and felt horrible. And it's a very, people don't understand that teaching is kind of stressful. And, I just wasn't loving life because I was not feeling well at all. And so I went in for that. And just the fact that I needed anti-anxiety medications to start the school year should tell me something. And so, one thing led to the other, and I ended up at Mayo Clinic, which was awesome at, identifying, doing scans with ultrasound and identifying the thyroid cancer. It had spread to my lymph nodes. There was 30 of them that they removed in the first surgery. I had another recurrence about a year later. They either missed a couple of lymph nodes that were malignant, or it was a new growth. They don't know. They just called it a recurrence. And in between there, of course, was medication management, radioactive iodine, where you have to isolate depending on the dosage you get, where they give you a cup of water and the radioactive iodine in a cup, and someone comes in to give it to you. It's a covered cup with a straw, and it's all taped shut. And the person who's handing it to you in nuclear medicine department is wearing basically a spacesuit. So I've had that 3 times. And then I've had something called Thyroid, which is another diagnostic treatment. And I've had 3 PET scans. So because of potential recurrence with tumor markers and just watching what's going on. So it's yes, easy in the sense that it is highly, the prognosis is really good. It's 95% or more 5 years later. I'm 14 years out now. I don't consider myself thyroid cancer, that I have thyroid cancer anymore, but I'm also do surveillance every 6 months. So there is that component that sort of hangs over your head. So anybody who's had anything that they have to constantly watch, the toll that takes on your psyche and your emotions, even when you get used to it. So you kind of get used to it. So this is just me sort of seeding what I want to talk about later with external stresses in our lives. So that is my story. There's much more to it, of course, but I will not bore you with the details. But I want to talk a little bit about this link with breast cancer. And it is something that I never thought about and was never told about, that there is a link. And honestly, I think it's more because it seems to be new-ish information since when I was diagnosed. Also, they did tell me that because of the way that they have to suppress my thyroid with my thyroid medications, suppress my thyroid numbers to keep tumor markers at bay, that because of that, there is a little bit more risk of heart issues, palpitations. And I have had, some of that and gone through bouts where, I think I might have heart damage or something like that, where I've had to do things tied to that, which are, again, very scary. It's not cancer, but it's a whole nother thing that, here I am, relatively young and worrying about heart problems and heart disease like issues. Excuse me. Excuse me. So I just want to talk a little bit about that link. So women with thyroid cancer are at risk for subsequent breast cancers. And women with breast cancer have an increased incidence of thyroid malignancy too. So there is a common etiology there, and it's not well understood. So one of the things that they do think is a link is a genetic factor. Now, I have not gone down the road of dealing with breast cancer, thank goodness. I also did not have any genetic component for thyroid. As far as it running in my family, no other person in my entire family has a thyroid issue that anybody knows about or that's being treated for, anything like that. So there is something to that. And, they don't have direct links to the genetic variants though. So there are some variants for the breast cancer that will tie them to the thyroid cancer. So the HER2 and there was one more that I had read about too. I'm sorry, I cannot find that right now. So they also think that it has to do with hormonal signaling with thyroid hormones and the estrogen type hormones. So the estrogen, progesterone, probably a little bit of testosterone, and they tie that back to lifestyle and environment. So back when I was dealing with my issues, and I was not a nutritionist at this point, but I was always been really interested in that. I have a science, background. I taught anatomy, physiology, biology, and chemistry, physics, and that kind of thing. So I have a science background. So I knew enough where to go and look that there had to be something else to keep myself feeling better, because I thought, again, with this thyroid cancer diagnosis, having my thyroid removed and taking medication, that all of a sudden that would solve all of my problems and my symptoms. And it didn't. It just actually made it worse. And so I thought I needed to dive into, what am I doing? What can I control? And that's where the proactive tenacity, I guess. I was so miserable that I could not live like that any longer. So I had to make a change. Nutrition is where I first looked, and then gradually getting into the lifestyle, environmental type of things. And it all counts. It all makes a difference to your health and improving your symptoms and outlook. So thyroid cancer, the incidences in the last decades have tripled. But back when I was researching about thyroid cancer, there's a huge connection. And I believe it's a book called Silent Spring that's not even in print anymore. It was printed a long time ago. But back then, I want to say in the 50s, back then, they even tied thyroid cancer, the prevalence of it, to environmental factors and chemicals. And I come from a small rural area where farming practices, where anhydrous tanks sitting in the fields, being sprayed when you drive by, the crop duster, spraying the field is swooping down over your yard and that kind of thing. That was commonplace for us. And incidentally, there was a classmate of mine, the day I was diagnosed, she died of thyroid cancer, and she had a different version of it than I did. And she lived in the same area as I did as well. And so for a class of 58 students, that seems pretty high that someone actually, two of us got it, and she died. And I've learned other people in classes around my age, there's actually about 10 of us that have thyroid cancer or have had it. So one study even said, because it's easy to think even with the breast cancer malignancies, that things are getting diagnosed more because there's better surveillance, there's better imaging and all of that kind of stuff. One study even showed that that's not the case for thyroid cancer. We're not tripling our incidences of thyroid cancer because of surveillance and testing and imaging. It just is truly what's happening. So the survival rate at 5 years, I mentioned this before, is 90% or above, depending on the type of thyroid cancer you have. And then thyroid cancer risk following breast cancer, if you had prior benign breast disease, and it's reported both in men and women, actually. So men having thyroid cancer and a breast cancer connection as well has increased. It's doubled, is what I have read in my last study I looked at from 2019. So those are the connections there. And whatever the connections are, I guess we can't really do much about that, but we can do things to help mitigate symptoms and to help us be as healthy as we possibly can. And so the things that I want to mention to you now going forward are just things that will be really helpful for you to put into your life, put into play, and to start adding this in and having it accumulate into, a really good, healthy lifestyle. And that's what is really important for this or any condition. Okay, so the things I want to talk about are, I just lumped into a few categories, 4 categories actually. Lifestyle management and managing our stress, balancing hormones, turning to whole foods, and then specific nutrients to consider for your thyroid health. All right, so I mentioned the thyroid cancer incidence and environmental factors. So what we need to do is decrease toxins and chemicals in our environment. And we can do that with numerous things. You should, consult Amy Carlson with getting rid of toxins for sure. But we need to do that by eating better quality foods and staying out of packaged and processed foods as much as possible. That is one big way, because you have to eat every day. So, you could start decreasing the amount of chemicals and toxins you are adding into your system, so that you can start there, because you need to eat every day. So that's a good way to do it. So move to less processed foods. And then not to mention your household cleaners, perfumes, lotions, makeup, skincare, that kind of thing are ways. There are many ways that you can improve the quality of the products you're using to help minimize the risk of, taking in those chemicals and toxins. Increasing your whole foods, like I said, moving away from packaged processed. The easy way to think about it is shopping the perimeter of the grocery store rather than going down the aisles for all the boxed colored foods, the fake foods. Staying with fresh, whole fruits, vegetables, nuts, seeds, and then looking at the quality of your protein that you're taking in, whether it's a vegan type protein or an animal protein. Make sure that it is the best quality that you can. So there's a learning curve a little bit with that. So that's something I do help people through with deciding, how to put their money at the grocery store and where to start. You don't have to do it all at once. That's the best thing. From the managing stress aspect of things, one of the things that I notice with the people I work with is that they underestimate the stress that they're under, because it's become so normal to them. It's our normal as a society to be go, 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 tired and wired. We brag about how little sleep we need and that kind of thing. And that really, really impacts our ability to handle disease. It affects our overall health. And so what I would do is take an assessment, for yourself of your stress levels and look at ways that you can take more time for self-care. It's not selfish. It's imperative that you do it. I know a lot of times women get bogged down with that, with parenting and all the mom things and household things. It's just something that happens. We put ourselves last. You need to start putting yourselves first more often and taking care of those situations. Now, I would recommend starting just easy ways to start with journaling. That is kind of meditative in and of itself, and just putting all your thoughts down. I don't know, writing a poem, whatever feels good to do, write it down, or however you want to write. Prayer, meditation, whatever that looks like to you. Some people do kind of a combo, prayer and meditation. Again, whatever resonates and feels good to you is what you should do. Yoga, stretching, any kind of movement, a walk and talk, just being and sitting outside, even just being out in the sun is really important, to get some good fresh air and some good, natural vitamin D every day, if possible, is really important to your health. And then the other thing that gets so downplayed, and I think we're becoming more and more aware of it, thank goodness, is sleep hygiene. We think if we get 5 hours, 6 hours of sleep and we have energy to go through the day, we're good to go. But most of us, over time have hopped up on caffeine and different kinds of chemicals to get us through the day, and energy drinks and all those things. And that only causes us to be more stressed out over time. So it's really important to look at your sleep hygiene. I know just a couple of years ago, I decided to really dig deep into that. And I bought myself an Oura ring. I wear it on my thumb just because it's kind of thick. And that's really taught me a lot about my sleep quality and how it's affected by the behaviors the day before. If you eat a little bit later at night, if you have a glass of wine, if you're not feeling well, if you have kind of cold, something going on, that definitely affects your sleep and your quality of sleep, not just your quantity, but your quality. And that's what we need to do. So those are things to start thinking about, take an assessment, what works for you, what would you like to try, and start implementing here and there. For balancing hormones, obviously, if you're on thyroid medications, you need to work with your doctor, your practitioner who's prescribing those medications. And hopefully you have someone who is listening to your symptoms and how those doses feel to you. I work with a lot of people who unfortunately are not getting that kind of feedback and not that kind of support from their providers. So, please work on finding that or reach out to others so you can find someone who will listen a little bit more, because it's really important to have your thyroid medications regulated. And then also look into your hormones and how they're regulated. So find a functional practitioner that can help you with both. And so what we can do with balancing hormones, again, if you're working with a doctor, they can prescribe, hormone medications or bioidenticals or compounded type hormones. But there's also a lot of things you can do nutritionally to help, remove toxins and excess estrogens from the body and different kinds of herbs and that type of thing. So you'll definitely want to get that all balanced, because the thyroid and those other hormones definitely tie together. All right, so that moves me again to whole foods. We already talked about this a little bit, but if you have a goal of trying to work towards eating primarily whole foods, you can do it baby steps. I mean, I have people who eat at the drive-through probably once a day, if not twice a day. So sometimes we start as small as, okay, you can only eat there once a day. Make it a goal to only go through at breakfast or something. Not that I'm saying that they should eat there once a day, but to try to work it into their life so it's sustainable, just back off by one notch, take that second fast food meal out of the way and then replace it with lunch that you pack at home. And, that's what you can do to start. So just working on replacing areas that aren't so great with your meals with whole foods, lots of plants, eat more plants, real plants, because those help with, again, removing those excess estrogens and tons of antioxidants and tons of micronutrients to help your body just feel better and work better and more efficiently. So that is really important to do. Then moving on to nutrients to consider for thyroid hormone specifically. There are things that thyroid patients need, and it helps. I could say from my own perspective, it helps my medication work better, if that makes sense. So I will always be on a thyroid medication, and I am on a synthetic for both T4 and T3. That is what has worked for me. I've tried the more natural forms of thyroid hormone, and it has not gone well, not at all. But you need to have a practitioner that's willing to work with you, because there are people that have changed from synthetic to more natural, and it has changed their life. So I encourage people, again, be proactive, speak up for yourself, and don't just sit back and be a wilting flower and not, ask the questions or get the answers that you want and need. You deserve that. So the nutrients for thyroid that I highly recommend you have assessed, and this is something I do all the time, and it is so telling and so important, and people's symptoms can start to be, resolved very shortly with things like energy and maybe some gut health symptoms, anxiety, depression. I wouldn't say it's cured, but it starts to level people out, and they start to have a better outlook. They are better at self-care. They're better at eating better because they have the energy to take the time to do so. So have your cellular level nutrients. That's my wheelhouse. That's my preference. But you need to have good amounts of selenium, zinc, copper, because those are really important for helping your thyroid hormones created and converted into the active form. So you've heard of T4, T3 potentially. T4 is considered the inactive, and it needs to convert into the T3 to help you feel more the energy and to have your thyroid hormone system working at par. So, or better than par, hopefully. Other things, so you get those through nuts, seeds. Brazil nuts in particular are associated with selenium. Oysters, grass-fed beef. I mean, there's a variety of foods you can eat, whole foods you can eat to help optimize those levels of minerals. Iodine in foods, that can be a little bit tricky with an autoimmune patient. If you have autoimmune thyroid condition, maybe even other autoimmunes, I'm not exactly sure how that impacts that, but definitely seek guidance from your healthcare practitioner, functional medicine practitioner. Sometimes iodine can wreak havoc with your prescription of thyroid hormone. So you definitely want to work with someone on that. So you can get it obviously from seaweeds and kelp and that kind of thing. That is not something that I like to eat myself. And I struggle with that. But so far my iodine levels have been okay. So check with that. And then magnesium. So we hear about magnesium all the time. It's so important in over 300 enzyme reactions in our body. So we really need to be, have sufficient amounts of it. And that's also needed to help convert your thyroid hormone. So if you are, have mood issues, if you have a lot of anxiety, if you're not sleeping well, if you have, tightness with your muscles a lot, I hear about muscle fatigue and pain with thyroid people a lot, and partially connected to some magnesium levels. So what I recommend, getting good quality of magnesium and taking, a glycinate form, an orotate form. And if you really do have that anxiety piece going on, the 3-in-8 form can be really good because it can cross the blood-brain barrier and help you out in that way. So magnesium is really important. So it is also important for things like blood sugar leveling out, which I didn't even address that, but we need to balance our blood sugars too, along with those hormones and the hormones that deal with balancing blood sugar. So we really need to do that by eating regularly and whole foods primarily. Excuse me. Leafy greens and crucifers, again, super important for removing excess estrogens and toxins out of the body via the GI tract. And so we all know the GI health is super important. And that's partially why we want that stuff to be removed and gotten out of our body so that it doesn't basically, I guess, in essence, recirculate and keep us in that hormonal imbalance. And so I know that there's an issue often that people bring up about eating cruciferous vegetables. So that's going to be broccoli and cauliflower and that type of category of vegetables, and how it can affect the absorption of our thyroid medications or affect the conversion of the thyroid hormones. But from what I have seen, and any doctor I've ever gone to regarding my thyroid, they've never brought up that with regard to taking my medications. I guess that might not be too surprising because I know they don't get so much into the nutrition aspect of dealing with your thyroid condition. But studies I've read that it would have to be a huge amount of crucifers in small settings that would cause that impact. And so if you're not eating any of those now, make sure you're adding those into your rotation. And if you steam them just even a little bit, that can help break that down a little bit and to lower that risk. But again, if you are on a medication and you start eating a whole bunch of cruciferous vegetables to help with removing those excess estrogens, and if you see that you're doing nothing else different and your medications are changing, or your dosage needs to change, or your symptoms are changing, then for sure, look at that and see if there's a connection. Work with your doctor on that. And then this is last but not least for sure, gluten and dairy are definitely factors in thyroid function, especially if there's an autoimmune component to it. So both of those categories of foods, those proteins, and I'm speaking about the casein in dairy versus the lactose. So it's not so much a lactose issue for people as it is a casein issue. And both of these are very inflammatory for a lot of people. It doesn't mean that you're, have celiac disease or, that you're necessarily allergic to it, but it might be, those are kind of tricky words because allergic, intolerant, sensitive, all those kinds of things, sort of, we all know what that means, how that affects us. But if you are consuming dairy and you remove it to test it out and you notice that you're not as stuffy, you don't have a gunky throat, you're not clearing your throat on a regular basis, that's probably a good sign that dairy isn't the greatest thing for you. And by removing it, you're going to feel less inflammation and, other things work better. Plus the quality of the dairy is also a factor in that. And then gluten, we all are familiar with that with regard to celiac disease. And so, like I said, if you're a celiac, clearly you're not going to be eating gluten. But if you're not and you remove it, you're going to probably notice all kinds of changes if you do have an issue with it with regard to inflammation again. So also there's something called molecular mimicry, which can, if you have an autoimmune condition with thyroid disease, then it can look like thyroid tissue and your body can attack it. So that's where you get a lot of the inflammation. So molecular mimicry is a thing that I deal with or talk with my thyroid people a lot, because oftentimes they find when they remove gluten, their bloating goes away, their GI health gets better. And one thing that was surprising, and it was true for me, was the anxiety and the kind of the mental health aspect of things improved by removing it. So again, there's 1,001 symptoms that can be caused by gluten sensitivity. But this is something I would look at and see how that affects you. And the other thing is, a lot of the things that have gluten, so wheat, barley, rye, are highly processed, lots of chemicals. Like I talked about in my hometown, that's what they do. They grow their food with lots of chemicals, and that's just how things are done in conventional farming. And so those things, have everything else to it. So I believe 100% that it's not just the protein in the gluten. It is, the other stuff that comes with it. So, and then just a caveat there, I've had people remove gluten and then swap it all out for gluten-free products of the same things they love. So here's an example. Maybe someone eats toast or waffles on a regular basis. I don't recommend, but if you're eating like an Eggo type of waffle that's not gluten-free, and then you switch to a gluten-free version of it, chances are you're going to have more inflammation and probably put on weight from that. I've seen that happen over and over again because people switch it to something that has more of an impact on your blood sugar, which I mentioned is really important for balancing all these hormones, and it makes symptoms worse. And so that's just one caveat I want to say. Don't replace your gluten with gluten-free options that are processed and packaged, because that will actually backfire. It's okay to use them as a crutch here and there, but don't rely on them and overconsume those either. So, all right, so that is my talk with you. I hope it's been helpful. I hope you've learned some things about the connection of thyroid cancer, and maybe you resonate with some things that I've said with my experience with thyroid cancer. I'd love to hear from you. If there's anything you want more information on or questions, you can reach out to me. And I'd love to set up a talk and just chat with you about it and see if there's anything that you can do to help and improve your symptoms with thyroid. So anyway, I hope all is well. Take care, and thank you so much.